like to move on, it is my absolute pleasure to introduce our 2020 AGM keynote speaker, Dr. Jill Andrew. Jill and I go back quite a few years, and I'm so proud to bring her to you. Here are just a few words about Dr. Andrew, and I just want to say how much I love saying that. Dr. Jill Andrew is the Member of Provincial Parliament for Toronto St. Paul's, the NDP Culture Critic and the Women's Issues Critic for the official opposition. Jill is the first Black and queer person to be elected to the Ontario Legislature and reportedly in Canada. Jill is also a member of the Ontario NDP Black Caucus, the first of its kind in the province. Outside of politics, Jill is the co-founder of Body Confidence Canada and as the co-founder of Sizeism Sucks and Body Confidence Awareness Week. Jill advocates to end size and appearance-based discrimination, gender-based violence, harassment, and bullying. Her first private member's Bill 61 is advocating for the establishment of an Eating Disorders Awareness Week, the first week in February across Ontario. Jill's co-edited anthology, Body Stories In and Out, With and Through Fat, will be published this year by Demeter Press. She holds a Child and Youth Worker Diploma from Humber College, a master's degree in Women and Gender Studies from the University of Toronto New College, and a PhD from York University's Faculty of Education. Jill's dissertation explored the trifecta of racism, sexism, and fat hatred experienced by Black women in the GTA, their strategies of both accommodation and resistance, as well as everyday systemic and policy reform necessary to facilitate sustainable change. So I now welcome Jill Andrew to take it from here. Thank you so much for joining us.
So I'm muted. Oh, here we are.
You're good. You're good now.
Okay. Thank you so very much for having me today. Apologies for being booted out of Zoom. Now I'm back, so that's a good thing. Nonetheless, I'd like to, first of all, hope that everyone on this Zoom, that yourself and your loved ones are managing as best you can during this unprecedented pandemic. This is certainly a time where the inequities that many of us have long known, not only during COVID-19, but have known personally through lived experience, have certainly been exacerbated courtesy of COVID-19. It is my hope that this has provided a reset button, so to speak, for our country, our nation, all of our provinces, our territories, so we can actually get back to prioritizing the work of centering those who are made to be most marginalized and vulnerable in our communities. And by name, I mean Indigenous communities, I mean Black communities, I mean trans and LGBT and gender non-conforming communities. I mean those in our community who are differently abled, disabled, you know, those who are seniors, as we've seen, who have been particularly hit during COVID, but are often not on the radar as they should be, in my opinion, a priority. So anyways, just to track back a bit, I am Jill Andrew, Member of Provincial Parliament for Toronto St. Paul's. I'm also a proud member of the Ontario NDP official opposition. I'm also the Women's Issues Critic for the NDP, as well as the Culture Critic. So I really appreciate the opportunity to speak today for a few moments, you know, contextualizing my work around body image and body diversity. My goodness, it's been a long journey, very, very long journey. I would say that this journey begun, or at least presented itself to me during high school. There's certainly childhood experiences I could discuss, but that'll be for another talk. During high school, I had a particular interaction on public transit where I was met with a trifecta of hate, similar to what I stated in my dissertation, around anti-Black racism, around misogyny, and certainly around fat phobia. And that sort of opened up my mind. It sort of made me realize, you know, for lack of better terms, just how randomly I, as a Black woman, as a fat Black woman, could be mislabeled, mistreated, harassed, verbally assaulted, abused, discriminated in public. And what it really also honed in for me was the lack of support that I had in this public space, where people either, laughed, or they just sort of looked away. And these were not just children. When I've told this story, I've been asked, "Oh well, Jill, kids will be kids, right?" These were also adults, and I gotta say, on a caveat, this idea of kids being kids is also very problematic, because we know many kids. I know you've got them in Winnipeg as well. We know many youngsters who are positive bystanders, who take a stand when they see injustice. So this notion that children, are not able to participate in liberation, aren't able to participate in addressing oppression is ludicrous. It's absolutely ludicrous. But nonetheless, my work around body image, and body consciousness, and this notion of, connecting our individual bodies to the social and political and economic and cultural and intellectual institutions and spheres that also define us and also allow us to navigate in this world. It's crucial work. It's absolutely crucial work, because in my opinion, if we're unable to see ourselves reflected in those institutions, if we're unable to feel like we have, a chair at the table, a seat at the table, then we are perpetually feeling like we're on the menu, and it's crucial that we have space. It's crucial that we take up space unapologetically, so we can try to address the various body injustices, race-based injustices, misogynies that continue to plague us as a society. So as women's issues critic, I haven't had a chance to do as much work with Body Confidence Canada as I would like to do. But, I recognize in life that sometimes when you are asked to step up for a great opportunity, such as becoming a member of provincial parliament, you take a chance in life. What I've been able to do, however, is bring the passion and bring the sentiment of the work of Body Confidence Canada into my role as a new politician. And that sort of came with Bill 61, which I had tabled in the House back in December of 2018. Bill 61 was a bill to recognize the first week of February as Eating Disorders Awareness Week. And just to put that into a bit of context, there's about 1 million people in Canada who are living with, struggling with, surviving with eating disorders at any given time. And I put disorders in air quotes because many of us in the socio-cultural world, while we recognize eating disorders as the number one mental health illness, actually, what we also know is eating disorders are oftentimes a response to a disordered society. They are a response, a way of regaining control when one feels like they have no control in the worlds around them. So Bill 61, I would say, was certainly influenced and informed by my work with Body Confidence Canada, by the work of Body Confidence Canada Awards, which had actually awarded the Women's Health Clinic a Body Confidence Canada Award. And that's when I met Lisa Naylor, trustee and now MP. That was a very, very wonderful time, and that's where Bill 61 really, came from in terms of being inspired by. I mean, obviously my personal experience with body issues and my own journey, the experience of stakeholders and community members, and I should correct that, actually, MLA. My apologies, Lisa. My apologies. But nonetheless, this is where the work has stemmed from. Over the years, we have been able to award several people across the nation who were doing incredible body justice work, who were advocating for policies and practices and images and dialogues that shift the idea of which bodies matter and which bodies clearly in our various systems do not. It is not lost on me that we are in a very particular moment. You know, people have been asking, you know, oh, how are you doing during this pandemic, you know? But what we don't realize is that we've been living with the pandemic of white supremacy for a very, very, very long time. And white supremacy has taken its toll on many of us, some more than others. Again, whether that's physically, because we have links, we have research that demonstrates the link between discrimination, anti-Black racism, anti-Indigenous racism, and our physical health, certainly mentally and economically. So this is a time where we have to take pause. We have to stand up. We have to advocate, and we can't only talk. You know, we have to act. And acting for me in this position as MPP, you know, does come down to legislation. You know, it comes down to our dogged fight, you know, in Ontario to have an anti-racism directorate. You know, it comes down to our dogged fight nationally for all of us to see our federal government, you know, stand up and have a plan for missing and murdered Indigenous women and girls. You know, it looks like us ensuring that our curriculum, you know, in Ontario, and I would argue across our nation, reflects the kids that are sitting in our seats, for goodness sakes. It is deplorable, you know, that you all have witnessed, you know, our province, you know, trying to claw back sex education, you know, pandering to homophobic and transphobic conservative bases, you know, completely severing, you know, work that was to be done to advance Indigenous curriculum, work that had already been organized and paid for, you know, just having the plug pulled. And certainly we continue our fight to have, you know, Black history, you know, African, Black, and Caribbean history centered in our curriculum as mandatory courses. So these are just a few of the pieces that we know we still have to fight for. You know, when I talk about body justice, you know, some people say, well, you know, it's, you know, size positivity. Size positivity is actually, it's a huge part of it, of course. But there are so many other ways that we have to have body justice. There's so many other ways that we have to have, that we have to be able to feel safe and free to walk in this world, to move in this world, I should say, actually, because many of us move differently. You know, to move in this world, free of a sense of over-policing, you know, free of a sense of being hyper-sexualized or hyper-visibilized in a way where, you know, we are negatively treated. You know, these are things that we have to keep advocating for. I certainly have no intention of stopping, none whatsoever, way past COVID-19. You know, we have to dismantle the institutions that have been allowed, not even allowed, they have thrived, quite frankly. They've thrived on the backs of the most marginalized. They thrive on oppression. You know, they thrive on white supremacy. They thrive on keeping us pegged into certain tropes that don't allow us to be human beings. You know, and this is why as well, too, in the House, I also, you know, put forth a motion for us to have a provincial gender equity strategy, you know, particularly an intersectional gender equity strategy, you know, in Ontario, one that looks at race, one that looks at gender, one that looks at all of the intersections and how our bills and our emotions are impacting these lives differently. Because no, we're not all the same. We're not all the same. You know, all lives matter rhetoric and, you know, there's one race, the human race, all of these cliches. Maybe in a perfect utopias world, you know, where inequity didn't exist, they would have some resonance. They could have my audience for a second, but we're just not in that world. We're absolutely not in that world. And that means that we have to address inequity. You know, we have to recognize a quest for equity as the way to getting to so-called equality, you know? So I'm trying to do the work that I can, whether that's advocating for pay equity, whether that's the continued work around anti-bullying in our schools. And again, I have to give Lisa Naylor a huge shout out because while she was a trustee in the Winnipeg School Division, Lisa Naylor was a huge part, quite frankly, of why we were able to get Body Confidence Awareness Week started in the Winnipeg School Division and throughout the TDSB. You know, this is what allyship looks like. You know, people recognizing an issue, connecting with their community, rolling up their sleeves and doing the work. And that's who Lisa is. So, you know, and I'm sure there are many of us on the call who are just as adamant about making change. And that's what we have to do now. We must make change. Not only our lives depend on it, but our health depends on it. Our health depends on it. And, you know, as we talk about COVID recovery, for goodness sakes, you know, before I wrap up, because I'm looking at the time as well, as we talk about COVID recovery, you know, and our health, we must talk about mental health. We must talk about culturally relevant and responsive supports for mental health. There's no cookie cutter here. You know, in our province, you know, our government cut the mental health, you know, by $330 million, for goodness sakes. It was one of the first things they did, you know? So now we're getting over a pandemic, quote unquote, getting over, right? You know, I personally think we've all been working so hard and we've been so stressed out and we've been so covered with grief that I think we're just getting through COVID-19. I don't believe that we've really begun unpacking the wear and tear that it's had on our body and our mind. So we have to center mental health. We also have to center an agenda that tackles anti-Black racism and anti-Indigenous racism. And while doing that simultaneously, we also have to remember climate change. You know, we have to also find a way to recover economically that A, is not on the backs of the most marginalized, and B, doesn't take us away from recognizing the state of disrepair, frankly, that our environment is in. So, you know, with that, I will wrap up, and I will say this about COVID-19. You know, we must commit to moving forward in a way where no one is left behind. You know, consistently we say we're in it together. Oh, we're in this together. We're in this together. I'm guilty of saying we're in this together. But as we see people on the sidelines, you know, those of us who know of or are part of communities that have historically been peripheralized, we recognize that we are not in this together. Many people are being left behind. Many of our essential workers here in Ontario are being left behind. Many of them are not even getting the hazard pay that they're supposed to receive. And many of these people are Black and racialized and Indigenous, and they are women. They're women. They are women. They are women, you know? So we have to do better. We have to do better. You know, in the beginning of this pandemic, we told people to stay at home. You know, even that narrative could be unpacked, because for so many women, you know, for so many trans folk, for so many people who experience gender-based violence, we know that home wasn't safe. You know, for so many of our LGBTQ 2S plus community members, my apologies, folks. I was cut off with my internet once again. Thank you very much for having me. If you wish to reach me, I'm available at jillandrewmpp.ca, and you can also find me on Twitter or Instagram at Jill's Last Word. Thank you so much for having me. I'm sorry I can't stay longer today, but we do have to get back to St. Paul's business. So onward and upward, everyone. Thank you.
Thank you, Jill, Dr. Andrew, for your inspiring words to get us started this afternoon. I really want to thank you for sharing your trifecta, that trifecta that is all the more important to acknowledge around health and mental health, racism, and body justice. I love that term. Body justice is so inclusive of all of the things that we face when we're struggling with, whether it's disordered eating, whether it's thighs, whether it's, I mean, that it just embodies and encapsulates so much of it. You know, what I heard you talk about was really a public health crisis that we're in, that isn't being acknowledged through that intersectional lens of indigeneity, Blackness, health, education, right? All of the connections. So thank you for connecting the dots, because what I see not only in your formal work and what I've known of you, dare I say 20 years, because I know my oldest son is 20 and we met when he was in, you know, quite young, so maybe 15, we won't age ourselves, but we've known each other for a long time, and you've never failed to say something that makes my brain go, hey, yes, thank you so much. So thank you for sharing that with all of us. And thank you for joining us all the way from Toronto.
Thank you very much. I'm going to add my my contacts in the chat box.
Yeah, that would be great.
To reach out to me. I really appreciate your time today. Thank you, everybody.
Wonderful. Thank you so much for joining us.